Jane has are topics that we feel are very prevalent and that would be applicable to a lot of people. And this topic is definitely something that we see a lot of, and it's markedly on the rise. And we felt that many people would probably have some relation to this particular topic about autoimmune disease. And so we are working in office. We're also seeing patients virtually. And as of today, if some of you may have come to our kitchen, to our teaching kitchen, but as of today, we had the first episode of the Thrive virtual kitchen. So we are now recording that. We had to record it today, but it will be live. And so we will be having an educational series with our kitchen, and it will be easier for people to attend because we will be virtual. So we're going to be talking about implementing a plant-based diet, which is very much attuned to anything we talk about. So are you ready for me to get on with the talk? Do you think that's?
Yeah, I think it's and so if how would you prefer, Dr. Fletcher? Would you prefer to take questions at the end, or would you prefer, or you want to kind of let people ask questions?
I think people can ask questions during. Would you just? I guess I took the chat box away, so I guess if you want to just let me know, I'll pause from time to time and see if people have questions about the particular area maybe I've discussed.
Okay.
And then I'll keep an eye on the clock, and then we'll allow some time for questions at the end.
Okay, so yeah, so feel free, you know, if you have a very pertinent question to that particular subject, or maybe we can just cover it all at the end.
Yeah.
So we can kind of do it a variety of ways that works. Okay.
So today's talk is about autoimmune disease, and really how this has become an epidemic in this country and worldwide. This is a talk that I summarized. I had done a 4-part series on this during COVID, and it is actually, I put it together as a program with handouts. So if there are things that I go through with this that you're like, I really just want to get into it in more detail, it is a 4-part series, and we have a lot of other information about it, because this has really just been the incidence of autoimmune, and I'll show you some slides, has really skyrocketed over the past 20 years. I told you a little bit, I don't know why my slides are not advancing. There we go. So I told you a little bit about myself and about Thrive already. Today, we will be talking about sort of how we look at autoimmune disease with a little bit different lens than maybe a traditional rheumatologist, endocrinologist might look at that. And we're going to look a little bit more at the role of the microbiome and how your diet and lifestyle can certainly change the course of the autoimmune disease and how well you do. I'll present a few little bits of things about testing, and also a little bit of stuff more about medication. We've really had to rethink how we look at disease and health, how we look at the role of our food, of our genetics, and the interplay of all of these things as they pertain to health conditions. And that goes anything from diabetes to hypertension, and specifically, there's a big role for that in autoimmune disorders. Preventive medicine and curative medicine and traditional medical training, which is how I was taught at Wake Forest, is that we really just diagnose a problem and we give a prescription or an antibiotic, and we're really sort of addressing it once it becomes a problem. And what we like to think about, and I know that your group is really trying to promote healthy lifestyles, is to get ahead of that, to go upstream, to turn off the faucet before we have a lot of problems. And this can play a role with autoimmune disease, in the fact that many people who develop one autoimmune disease are at dramatic increased risk for developing a second or a third. And so knowing what you can do is very important. My slides appear to be advancing themselves. So I will try to keep up with them. We know that health does not occur in a traditional office setting, and that really it's so important for the individual to be empowered to attain health and to make those lifestyle changes. And we know that the solution for preventing disease does not really come in a pill or a bottle, and I think most of you are aware of this, that prescription drugs and surgeries really People who are on a lot of these types of medications, they generally don't live as long and as healthily into their 8th, 9th, and 10th decades. So we want to promote healthy lifestyles. I talked a little bit about functional medicine and what we do, but we are really getting more into root cause, founding relationships, and empowering patients to be active participants in their health. I will skip this slide because it has a lot of writing on it, but really when we're looking at root cause of things and as it pertains to autoimmune, we are looking at genetics, and we are looking at the role of stress and the role of the environment and all of those things that go along with management of a disease, not just giving somebody a steroid for rheumatoid arthritis, but figuring out what else they can do with their diet. That's just one example. So we encourage active participation. Integrative medicine is part of functional medicine, and integrative medicine really looks at all the other aspects of healing, and we draw on that from other cultures. So that would be looking at manual therapies, massage, chiropractic care, Ayurvedic medicine in Indian cultures. With conventional practice, there is really a pill for every ill, and we diagnose it and we tell you what it is, and then we just give you a pill and tell you that's pretty much all that you can do. But the reality is there is a lot more that can be done from a management of disease perspective. So this is kind of what we talk about a lot, is really getting to the root of autoimmune disease, getting down to really what is below the surface. My slides are advancing fast. So simplistically, autoimmune disease is when your body starts to attack its own tissues. There are a huge variety of autoimmune diseases. Many people are familiar with thyroid, where your immune system is attacking thyroid gland. With lupus, it can be skin. With arthritis, it's bones and joints. With MS, we're attacking our neurologic system. With Sjogren's, it's eyes. It's all of these things. And this sort of simplistically explains what happens. So you have normal tissue, and the little green guys are your immune army of attack. And when you are sick, maybe you get COVID, your immune system sends out its army and attacks that pathogen or that virus and helps to get it under control. Unfortunately, sometimes the system gets out of balance and gets a little overzealous and starts attacking your own tissues. So you no longer recognize yourself as a friend, but the tissues are seen as foe, and you start to develop antibodies against yourself. And that can be problematic because then down the road, you develop a disease process, you develop damaged joints, which then we see rheumatoid, improperly functioning thyroid gland, because now you're no longer recognizing your thyroid tissue. So that's a simplistic explanation, but it's really your body is again at war at itself. And there are many circumstances when these things become more prevalent. And one of the key times that does happen for women is childbirth. I think we see a lot of autoimmune diseases that happen with childbirth, and we see a lot of them that happen under great periods of stress. And if any time in our history there has been a lot of stress, I would have to say we are living through it now. It will be interesting to see what is going to happen with some of these disease processes as we move forward, knowing, again, our immune system is being challenged with COVID, and how do we handle the stress of that? This is just a picture. There are probably over 50 million people living with autoimmune diseases. There are over 100 recognized autoimmune diseases. You can see that they attack all different types of tissues. Celiac is one, that's your GI tract. We have lungs, that's Wegener's, and we also see skin. Psoriasis is very common. Thyroid in the top right, also Graves', which is overactive thyroid. And this is just a small list. I have another slide that shows a huge number of the autoimmune types of disorders that we have. But this number of thyroid has really dramatically increased. This is about 5 to 8% of the population. And the alarming statistic to me is that up to 80% are actually women. And women are certainly at a little heightened risk. Some of this is due to what occurs at the time of pregnancy and huge hormonal shifts. The other thing is that once someone has one autoimmune disease, they're at about a threefold increased risk to have another. So if you develop thyroid disorder, you are at about a 15% increased risk you may have celiac. And then you could get rheumatoid, and then you may get psoriasis. So you have to go upstream and kind of figure out what you can do to keep that under control and to prevent future diagnosis of disease. So many patients see so many doctors to finally get the answer. On average, people see about 5 to 6 doctors over 4.5 years to finally get their diagnosis. They're kind of on this spectrum where things aren't right, they don't feel good, there's probably this smoldering inflammation and antibodies developing. And finally, by the time we have a Western medicine diagnosis, they've been suffering and have seen their PCP and maybe their endocrinologist and a second PCP, but it can take some time. And this was a study that was done by the American Journal of Medicine. So we know it's out there. There's a lot of it going on, and some of our testing hasn't caught up to being able to diagnose people soon enough. It's a very expensive autoimmune disease, $100 billion a year. Some of the treatments can be very expensive. Some of the new drugs that are used for like psoriasis, one is called Taltz. Humira is another one used for arthritis. But they can be very expensive for patients to acquire those if their insurance doesn't cover them. And this massive rise of 300% over the past 50 years. Some of it is that we have better testing. Some of it is that people are living longer and they have a longer time that they can actually acquire an autoimmune disorder. And some of it can be pertaining to what I'll talk a little bit about, which is the hygiene hypothesis, and that our altercations with our gut microbiome. So there is really no doubt that this is on the rise and that our environment is playing a role. There are lots of research articles and studies out about autoimmune disease, but this incidence, 300% incidence increase in the past 20 years is dramatic, and it's rather alarming. And on any given day, we see someone here. I've seen several people already this week. I've had 3 new cases of celiac in the past 2 weeks. Hashimoto's, thyroid, rheumatoid. I mean, and you all probably have friends and family members that are faced with kind of dealing with these, and people have to learn to live with them. It's not as often that they can be completely reversed. Sometimes, some of them can. This is interesting in that this just depicts the rise of chemical usage in this country over the past 60 years, and how ironically but maybe not so surprisingly, mirrors the dramatic rise in autoimmune disease, particularly over the past 10, 15 years. And this slide only goes through 2010. But it is just like a upward slope. I mean, kind of looks like that early part of the COVID graph that everyone's seen on the Johns Hopkins webpage. So, there is some correlation with what's happening with us, but also to how we're testing and diagnosing patients. This depicts celiac. Celiac, back when I was born, late 60s, incidence was 1 in 500. It was rare that you heard of it. Now, 20 years ago, the incidence was 1 in 100. It's a little higher than that now, but very, very common. And that is actual celiac disease. We still have all the other people who are on the gluten sensitivity spectrum. And many people who are living with it who have no idea that they are really being impacted by celiac, which is an autoimmune reaction to gluten and to wheat. This slide shows celiac incidence in the yellow bars and the use of glyphosate, which is found in Roundup. And again, there have been some associations with this, and implicating that is why we are seeing more of it in our country because of our altercation to wheat versus the type of wheat that is found in European countries where they are banned from using Roundup. So that is not the only cause, but it is one key factor for a number of people as to what is tipping them over the edge. This isn't just an alphabetical list of all the autoimmunes. And this is actually only 59 of the 100 that we know about. So this is how just a vast of a topic this can be. But getting to what we can do to help people, some of the same things can help folks to, no matter what the actual diagnosis is, because the problem that we're still looking at is your immune system. A couple more slides about top ones. I think type 1 diabetes, autoimmune to your pancreas. We have rheumatoid, 1.5 million people. Psoriasis, 7.5 million people. So a lot. At chronic inflammation, as we've talked about in some of our other talks, is really at the root of this. So it's inflammation, it's your immune's response, which we see with Alzheimer's, with cancer, with arthritis. And there's no one set prescription drug for inflammation. We really want to address some of this with food and with lifestyle, and that can help not just with one particular thing, but many, many other facets, and certainly helping people long term get the best results in management of their health in general. So some of my slides are. So why is it that conventional medicine isn't like curing everyone from autoimmune disease? And why is there so much difficulty? I think one thing is that there is no one autoimmune subspecialist yet. There is talk of creating a subspecialty for autoimmune diseases. If you have celiac, you see the GI. If you also have thyroid, you see the endocrinologist. So it's really viewed as an organ problem, not as an immune problem. And there is some thought that it is only genetic and there's nothing that you can do about it. And, you only have to take the medication. But we're learning more and more that there is more to treatment than just medication, and that some people can reverse the course of damage with their autoimmune disease, prevent themselves from developing future ones, and really kind of get a handle on that part of it. But it is interesting that there's not really an autoimmune disease subspecialist that you go to. You kind of go to the one that's organ's been attacked, except in the setting of rheumatologists do deal with quite a few more of the autoimmunes in general, and so do some of the GI doctors. So I think everyone's been inundated with hearing about your immune system and kind of what it does with COVID, and our understanding of viruses and what the immune system's response is. With COVID, what we see is this massive kind of inflammation, inflammasome response. And again, it's just knowledge that your immune system is over responding to something and attacking specific tissues. So we're kind of just being more mindful that the response is a little different with viruses and bacteria, but just immune has come to the forefront with Dr. Fauci and everything else with the immune system. This is a very complicated slide, but it just depicts that your immune system is very complicated. And at the very top, if you're exposed to viruses and bacteria and parasites and all of these things, there's this whole army of attack that comes in to help kind of fight that stuff off and keep you healthy. So if you get a cold, you've got a good immune system, you fight off the virus that caused the cold and you get back to your good health. But sometimes the immune system goes unregulated against its own checks and balances, and you start to attack your own tissues. And so that's why this can be important to kind of think about. I really did not like immunology in medical school, but I really do find it fascinating now. I think because we're learning more about how we can intervene with parts of our immune system, some, yes, with medications, but also with nutrients and with diet do play a role. Our immune system is so helpful for fighting against microbes, and it's also very important for controlling the growth of tumor cells. So, you want your immune system to be healthy and to certainly be in a very good balance. So supporting that with sleep, healthy nutrition, vitamin C, zinc, so many things that we know can be helpful. This is similar to, I think, a slide I had earlier, which basically will show that sometimes your immune system gets a little confused. And your immune system will form these little antibodies, and it may think like gluten, for example, may look very similar to thyroid tissue, may look very similar to dairy. And so sometimes it thinks that it's reacting against something that may be normal that it has to get rid of, but other times it may be reacting against something like gluten. And it can create all these kinds of what we call cross reactants and heightened immune responses because it cannot distinguish between friend and foe. So most of the time your immune system is very smart, but sometimes it gets a little overwhelmed. So that's a little bit briefly about this molecular mimicry. So if you are someone who has an autoimmune disease, some people are always asking like, well, why? Why did I get this? Like, why did I somehow, develop arthritis when I was 30? And why did I suddenly get MS or thyroid issues? But there's so many triggers, and what may trigger someone's response is going to be different than what may trigger your relative. In most cases, we know that with autoimmune disease, we've continued to identify more and more genetic kind of predispositions or risk factors that someone may have. Celiac, for example, there is a gene mutation for celiac. That does not mean if you have the gene mutation, you're going to get it, but you are at a higher risk if the conditions are right. In most cases, there is then some compromise of your intestinal permeability, which keeps 80% of your immune system below that gut lining. And there's like little holes in the fence. And then some kind of environmental trigger. That could be chemicals. It could be that you got really sick and got horrible mono. It could be that you had a rough period in your life and went through a very stressful event. But what happens then with these triggers is your immune system is unregulated, and then we start to attack different types of, again, organs. It's the similar kind of picture that I had earlier. But what we know with autoimmune is often like this little perfect storm, this little triad that sort of happens, and maybe you were susceptible, and then wham, it just kind of hits you. And many people will tell you, I know exactly when I got my autoimmune disease. I can tell you exactly when I ended up with thyroid disease, hypothyroidism. I was a second-year resident and taking night call, and there you have it. It was just the perfect storm. We know all these things at the top can be triggers to the gut lining, but can also be triggers for immune issues and lead to food intolerances. But at the bottom, we have immune system problems. So this slide is more along with our kind of talk about leaky gut. But I will touch base briefly a little further on about the role of your gut and your microbiome with the slides. And I'm skip that because that's kind of crazy. So the Human Microbiome Project is really kind of a huge undertaking, bigger than mapping of the DNA. And it's really us trying to figure out, like, what are all these bugs doing? What role are they playing? And how do they intervene? So there has been even more study about microbiome with autoimmune disease and, the balance of this. We know that certain bacteria put people at higher risk for certain immune disorders. Rheumatoid arthritis is one, for example. We do see some other associations with gut microbiome. But we're really at the forefront of this. There's so much more to come. I think you can't really check your microbiome and say if you're going to develop X, Y, and Z autoimmune disorder, but it is important because the microbiome and your immune system are so intricately entwined that you mind your gut and feed it the foods and healthy things that it needs. Many things can disrupt your microbiome, and things that determine how good your microbiome is, such as how you were born and if you were breastfed and how many antibiotics you might have been given, how good your diet is, if you're eating at McDonald's every day, or if you're eating things that Jane tells you to cook at home, or you may learn from our little teaching kitchen. But many of these things can certainly impact your gut and your immune system and its ability to fight off when it needs to. This is a book that came out, maybe 10 or 15 years ago, and really is talking about, it's kind of the first book that kind of increased our awareness of the overuse of antibiotics and the role that that is playing in the development of chronic diseases. We also touches on this book, Dr. Blazer, about this kind of how we got overzealous about overuse of sanitizers and being so cleanly and not really spending enough time in the dirt and allowing our immune systems to be exposed to some of these pathogens that we needed to be. So some of the things we backed off a little bit on, at least we had until COVID, but now here we are with hand sanitizers everywhere. But in any case, it's an interesting book. I had listened to it on tape. I found it really interesting. But so here's autoimmune disease in a nutshell, just kind of friends and foe. We always like to have a few little cartoons, but kind of, knowing which part of your body is your friend and which one's not. So that was a lot of stuff about kind of this epidemic and what autoimmune disease is and why we're seeing it. I just have some additional slides kind of about like what you can do and how you can figure out like what's going on. This slide also depicts the role of genetics, the role of infections, of your diet and chemicals. And if all those things kind of come together, the middle, there's many components. So it's not just the fact that you have a gene mutation for celiac that's your concern. It's all the choices that you make and your lifestyle that may determine ultimately if you develop an autoimmune disorder or if you develop a subsequent one if you already have one to start with. So this is a little busy slide, but this shows all of the gene mutations that have now been identified for specific disorders. So in the middle, SLE is lupus. And we see all these other little words that you see on that slide are all the gene kind of SNPs and things that we find. And there are some commonalities between certain ones like lupus in the middle and RA is rheumatoid arthritis on the right. But there are very similar kind of things that people will have because of their genetic makeup and findings that we see. So we're learning more and more about helping people know what they're at risk for. And maybe if you're at risk for lupus, you might also be at risk for some of the others. So not to get into too much with genetics. Epigenetics is really how our environment influences our genes. And that also plays a role with autoimmune because we know something needs to activate that gene if that particular autoimmune disorder is one of those that we know the gene kind of mutation for. So maybe you're at risk for celiac and, how is your diet kind of altering your chance that you may ultimately develop it, or how is your diet protecting you is how I like to think about it. Not that you want to be always trying to think glass mostly full, not empty. So, and I'll skip that one. So people look at what are the main things that will cause autoimmune disease. These are kind of bunched them into about 5 different categories. Leaky gut, exposure to toxins, chronic infections, we call these stealth infections, different food sensitivities, and chronic stress is a huge one. So in testing for, autoimmune disease, these tests, and I abbreviated them, but I'll mention what they are mostly, but these are things that like a rheumatologist may check or your primary doctor may kind of run these traditional labs through LabCorp. ANA is anti-nuclear antibody. That's a standard autoimmune test. Then we have some inflammation markers, thyroid markers. The last 2 are gene markers. So these are kind of, basic things that you may look at to say, okay, what's going on in the blood that may suggest something is going on. So we look at these in our practice, but we like to dig a little deeper. And some of the other things that we kind of do take a look at into figuring out, okay, maybe you do have Hashimoto's, for example, hypothyroidism. What other things may be contributing to the fact that despite you thinking your disease process is under control, maybe why you don't feel the best? And what other things might have triggered it so that you can get a handle on optimizing your health. So things that we may also look at would be things like looking at your stool, your microbiome, food sensitivities. Are there things in your diet that are making your immune system be a little bit overtaxed. Immune markers, markers for intestinal permeability. Often we're checking people for celiac because the incidence is greater than 1 in 100, and we are just seeing so much of it that it's amazing. And our people have never been tested and are living with these things, and we need to help them learn how to navigate their diet and their lifestyle. These are a few things that we do look at as well. I touched on this slide earlier, but this again looks at the importance of having a very healthy gut, having a very healthy microbiome, and controlling the things that may provoke it to get a little bit out of balance, or may put it at increased risk to create some more permeability, where you have, as you see, the little holes in there where toxins and food particles can slip on through that single cell layer lining of your gut and provoke food intolerances and a heightened immune response, and then everything kind of gets out of whack and gets very haywire. So this microbiome and autoimmune disorders, these were just a couple studies I think that I pulled when I was researching for this topic, and a few other that we have given on autoimmune disease, on gut health. But again, looking at where's the research, and there is a lot of research right now. I mean, if you Google microbiome in like PubMed or something on your computer, you'll pull up hundreds and hundreds and thousands of articles about the microbiome, and you can do the same and look at that with autoimmune disorder. It's interesting, they look at people who have Hashimoto's, which is very common, and they look at those patients who have Hashimoto's and those that do not have Hashimoto's, and they looked at their gut. They looked at their microbiome, and what they found was that the microbiome of patients who have Hashimoto's looks different than the microbiome of those patients who do not have Hashimoto's. And we don't quite understand, what all of this means, but we know that that is implying that there is certainly a role of the gut in those particular patients, and how do we impact that to optimize their health. Stool testing will look at infections. We know there are some infections that are more common in certain autoimmune disorders. We look at inflammation markers. We look at markers of gut imbalance. We look at markers of it's not the foods that you eat, but what you're actually absorbing. So if you are insufficiently absorbing your nutrients, that can be problematic as well, because you need all the nutrients and phytochemicals and healthy fats and proteins to best support your health, and particularly your immune system. This, the understanding of the number of toxins, and we've talked about this in our other talks, but so many chemicals in our environment that are not regulated, that are not tested. They have studied at least 150 industrial chemicals that have been shown to impact the production of thyroid hormone, TSH and T4. Mercury is a big one, but many, many other chemicals that we know directly can alter the production and have been implicated in thyroid disease. And also in cancers and many other chronic health conditions. I think this whole smattering of thyroid cancers up near Lake Norman was very alarming to our area, and was linked some to water supply. Also the higher incidence of, I think it's ocular melanomas that they've found. And these are just pertaining to things that have occurred around the Charlotte area. It starts to be alarming, but not to frighten people, but just to know it's so important to support your health. So it's not how much you're exposed to, but it is also important how your body handles that, how you handle the toxins that you are exposed to, and your ability to clear them and have a healthy working gut and skin. So these are different types of infections that have been implicated in certain types of autoimmune diseases. EBV is Epstein-Barr virus, so very common. The monovirus is very common. Many people have been exposed, but it is a trigger and association for Hashimoto's, for autoimmune. H. pylori is a bacteria that's been implicated with ulcers. Some of these have been implicated with rheumatoid arthritis. These are just insults to our system that then tax our immune system so that it can't function properly. Food allergies are things that we look at quite a bit. This would be a healthy diet. Hopefully you can eat all of these foods. But there are many types, and then we have a whole talk about food allergies and food sensitivities, but many types of food reactions that people will respond differently. IgE is a true food allergy, so maybe you have shortness of breath if you consume peanuts. That's a true food allergy. Then you have food sensitivity, which is not as severe or life-threatening, but can cause inflammation and can be delayed. And then we have a grouping, something called food intolerances, like lactose intolerance. Maybe you lack lactase, so you can't break down milk. So oftentimes these are all lumped in together, but we do know that many types of underlying reactions to foods, to get those under control, because it does play a role with your immune system, can help people with autoimmune disease. This just is a picture of a food sensitivity testing. Celiac is one that is very easy. If you have a family history of celiac, you can actually, through LabCorp, do a celiac gene test and see, what is your genetic risk and what are your antibodies. In people who have done the 23andMe testing, many of these kind of gene mutations are in there, which I just had someone today go home and pull it up and send it back to me and say, yes, actually, I found out I do have one of the gene mutations for celiac and a family history. So, knowing which of those tests are most important for you to help you figure out what is my risk and is there something going on with the symptoms that I experience that maybe this is an autoimmune disorder. So we do look at genes. We do look at some other expanded outside testing if kind of initial testing doesn't give persons the answer that they may be looking to. So some of the most common sensitivities for celiac, the standard test through LabCorp is not 100%. It'll pick up about 70% of people for celiac. So if your testing doesn't give you the answer, I tell people, don't settle. If we think that something else is still going on, we need to keep digging a little bit deeper. These list many of the antibodies or immune types of tests that are screened for people who have an autoimmune disease of a particular organ. So for celiac, we know what we're testing for, but these are ones that have been identified that are available through LabCorp. So type 1 diabetes, we used to not even have a test that was specific to say, oh, is it autoimmune diabetes or is it type 2? And that's just one example, but now we do have an autoimmune test to say, okay, yes, you do have a risk for diabetes, and this is why. The other thing is that most people will have evidence of the antibody before they have the disease. And you can see on the far right that it can be upwards of 10 years that you may have this smoldering antibody response going on, but you do not yet, in fact, have a Western medicine diagnosis. For celiac, it's about 7 years that you may have evidence of antibodies. They did a big study years ago on the VA and looking at vets that had elevation antibodies for lupus and how long it took them in that controlled population to have these lupus antibodies before they finally were diagnosed. And it was typically about 7 to 10 years. So if you can go upstream and address how to manage the antibodies and calm that down, maybe you could prolong the onset of the disorder, or in some people can actually reverse. I've had people reverse early hypothyroidism. So that's encouraging and very helpful for folks. So these are some other ones that are done through other outside testing through a company called Cyrex Labs. So we talk a lot about stress and just how important it is. We know stress can be a big trigger in that perfect storm of your risk for autoimmune disease. Our bodies were not designed to be under stress 24/7 as we are now. Even when we're home and working from home, we're still all kind of having stress, thinking about what's going on in the world. And this is a book that's been around for forever, but really just talks about the role of stress and disease and why zebras are able to just run it off and we have to sit and mull over it and get more stress every day. So because stress can raise cortisol, And cortisol is one of the top things that can suppress your immune system's response. And so it's kind of in the middle as to why it's so important to manage stress. And that can just be going outside and going for a walk or meditating or taking a hot shower or reading a book. So we know stress can drive immune suppression, but also mood and blood sugar and weight gain. So stress is very important. Oh, thank you. Hopefully, I don't know if you have any questions, but now that my slides are not advancing on their own, so we can get some questions. So the last thing is that I just wanted to say a few words about what else you can do with, from a functional medicine perspective, integrated medicine's perspective with autoimmune disease. Because in traditional medicine, you kind of like, well, the patient's got thyroid disorder, like hypothyroidism. Really all I've got in my toolbox to help them with is this little prescription for Synthroid, and really that's about it. So if you don't feel any better and your level looks good, like, I'm sorry, I have nothing else to help you with. So it's just an old Japanese saying, when all you've got is a hammer, everything becomes a nail. So we like to kind of broaden our view as to what other things can be helpful. With autoimmune disease, kind of the goal of conventional treatment is to slow the progress of disease, to boost immune function, and to control inflammation. And that is primarily done with steroids, commonly used, particularly with arthritis. I just think about lupus, psoriasis is high-dose steroids, prednisone, Medrol dose packs, immunosuppressant drugs like methotrexate. And then we have these newer kind of biologic response, and they are very effective for patients. And many people need to take these. We are not opposed to people taking medication they need to take, but they can have some side effects from taking them. So conventionally, these are kind of the main things, and then prescription medicine to give you the insulin maybe you don't produce, or the thyroid you don't produce. But in functional medicine, we do address those things as well. So in a combination, maybe someone does need to be on some medication, but we also want to say, what else can we do from their diet, an anti-inflammatory diet? What are we doing to address their gut? What else can we do to support your immune system's response? What can we help to do to remove any of these outside triggers in your environment or your stress level, toxins, your cleaning products? There's so much that we kind of try to open that scope as to what else can help you get to the point where maybe your pain is better managed from your rheumatoid arthritis or ankylosing spondylitis. Maybe your energy is better from your thyroid. You may still need to be on medication, but how can you optimize how you feel? And first and foremost, we spend a lot of time talking about food, talking about your diet, talking about healthy nutrition, which I know that you all do a lot of that. And it's just so important. And I don't know how we ever got so far away from thinking that we should eat clean food, and why we suddenly thought processed food was fine and an equal replacement. And it's really just know that food can heal. And it's just so important. Because we know that a highly processed, high sugar, nutrient dense diet promotes inflammation. We know it's directly related to obesity, cardiovascular disease, metabolic disease, but it is so important for, with the standard American diet, it does promote autoimmune diseases because it is pro-inflammatory. And we need to feed our good guts what they need from the microbiome perspective. Common inflammatory foods, top ones we talk about with elimination diet: gluten, dairy, soy, eggs, corn, and then all the bad actors, the too much caffeine, too much alcohol, too much sugar, additives, preservatives, high fructose corn syrup, trans fats, all those things that we all know that we should, at least if anything, get rid of the ones on the right. And if you react to ones on the left, then maybe you should try to limit how much of those that you're eating in certain folks, certain patients. So these are, again, top food sensitivities, and taking those out of your diet. So knowing that Mark Hyman, who is really one of the big promoters of functional medicine, that your fork is really one of the most powerful things that you can do to change your health. and to decrease your systemic inflammation by adding omega-3s and lots of nutrients. There's so many nutrients, particularly thyroid, of zinc and iodine and selenium, adding those important phytochemicals and antioxidants and so many things that you can get from plants that are high in nutrients and botanicals that promote reduction in inflammation. So these are some of the supplements that we do recommend for certain autoimmune disorders. And number one at the top of the list is always omega-3s, fish oils, hopefully as much as you can through your diet, food first. If you can't, we may need to supplement up to 3 grams. The role of probiotics and prebiotics, tons of data on vitamin D for autoimmune disease. We really like to have people's vitamin D levels like 60 to 80 if you have an autoimmune disease. Tons of research on medicinal mushrooms, very important. Curcumin, which is turmeric and ginger, again, cook with those, get them in your diet. You don't have to take a pill, have some tea with turmeric or ginger in it. And then the things on the right are also helpful: collagen for gut, healthy fats, plant sterols are low with fiber and healing nutrients. And we never like to forget about green tea because it is very anti-inflammatory and helps so much. And I won't get into the herbs. There are a lot of herbs that can be used. The one that's kind of highlighted right now that's being used from the viral effect with COVID is the second from the bottom, quercetin, is being used to modulate viral immune response, which there's been some interesting studies on quercetin. So it is a helpful supplement for people to take at this point in time. And then again, there's some other treatments on the horizon. The treatment talk is a 30-minute talk in and of itself, but looking at, maybe plan A is not working, what are some other things that are out there? Low-dose naltrexone is something that's been used for Crohn's, for hypothyroidism, for some autoimmune diseases. It works to reduce overall inflammation. And even fecal transplants have been used for people with inflammatory bowel disease. So again, there's many things coming down the pipelines that are going to be helping people, and the need is massive because the incidence has skyrocketed and is just overwhelming our country. So we need to find things more than some of these meds that we can use. And again, lastly, just the importance of sleep and exercise and like taking care of yourself. Very important. So this is my last slide. So this is my daughter and I. We went on this wonderful trip, just the two of us, and went hiking. And I think for me, having someone who has an autoimmune disease, like knowing like what am I teaching her about what she needs to do with her lifestyle so that, she maybe can prevent something, or if she does happen to get something because she got half my DNA, like what is she going to be able to do to empower herself? So our goal here is to educate and empower people to be proactive and to be, assertive about getting the health care needs that they need and really to optimize their health so that they feel better. So I don't know if anyone has any questions about anything. I'd be happy to take some questions. I know that was a lot of information, and I think I'm getting Jane the slides if someone wants the slides from this. I had some handouts too, so we can get those to you.
I have a question.
Sure.
I have Parkinson's, been diagnosed with Parkinson's, but I didn't see anything in your list of anything that would relate to Parkinson's.
Yeah, some Parkinson's. Didn't really delve into the Parkinson's aspect of that. I think, there's certainly a lot of research as to why people get Parkinson's. But that I wasn't really focusing on that with the talk. I think anything with Parkinson's, again, a lot of this stuff is applicable for many diseases and disorders. Diets high in phytonutrients and anti-inflammatory can be helpful. So,
Okay.
Any other questions?
Well, I have a second question.
Sure.
I was watching an infomercial the other day about leaky gut.
Yes.
And when you mentioned it here, I remember seeing that. This was a doctor who had formulated a mega number of ingredients into this pill that you take that would heal leaky gut. Is that,
Help with leaky gut. Mhm.
yeah. Is that legit?
I think there are many things that will help to heal the intestinal lining. There are some actual prescription medications. The kind of top things in your diet that will address leaky gut are omega-3s, healthy fats, bone broth, because it's loaded with collagen peptides. Glutamine is a super cheap supplement that can be used to heal leaky gut. Again, short term, not people aren't on these things long term. Many companies will formulate and put their combination of known nutrients that help to heal leaky gut, but it doesn't have to be expensive and it doesn't have to be complicated. So,
Okay.
yeah,
Thank you.
I think, yeah, the cheapest thing out there that really helps is either make your own bone broth. We have people do that, or glutamine powder is super cheap, and I have people do it for a couple months in a smoothie, and that's kind of easy. It doesn't have to be spending tons of money.
Is it glutamine? Can you spell that for me?
Yep, L-glutamine, Glutamine. It's an amino acid. So you can find that at probably even at Costco.
Okay, thank you.
You're welcome.
Alrighty, well, I just wanted to play, if anybody else has any questions, and if not, I just wanted to thank you, Dr. Fletcher, for being here with us and sharing great information as always. It's, you guys always, if you guys want to chat any recommendations for another visit from Thrive, let me know in a chat about another topic that they could bring if you have interest in. We've had so many great topics, and there's lots of things to learn from the physicians at Thrive, and their holistic approach is refreshing, and I have been personally impacted by it, so I just can't thank you enough, Dr. Fletcher, for coming on and being here with us. So thank you so much.
If you have other questions, and if you direct those to Jane, we can get back to you if someone has a specific question. So we'll reach out to us over here. So good. I hope
well, it's been great. Thank you. I just want to tell everybody about next week we have Wise Transitions. We have Kelly Markowitz who's going to be talking about balance and some issues with balance and what you might need to know, and also about how to create safety in your home. So we're all home a lot more, and just maybe want to be aware of how your home's set up and the things that might be problematic in your home. And so she's going to be with us next Wednesday. So again, thank you all so much. Dr. Fletcher, thank you for joining us, and I hope you'll come back and visit us again real soon.
Great. Thank you. Have a good day.
Thank you very much.
All right. Thanks, guys.
Question for you before you leave.
Yes.
You mentioned Thrive. Is that the supplement Thrive?
No. You want to take this, Dr. Fletcher? Thrive?
So Thrive is actually the name of our practice. Thrive Personalized Healthcare and Wellness.
All right.
There's a lot of Thrives out there, but we're a medical practice in Charlotte.
Okay.
Yeah.
My niece is involved in it, and I just wondered if it was the same. Okay.
No,
Thank you.
there's a Thrive Market. It's an online grocery store you can get some stuff from.
Okay.
But the Thrive practice is more than just a physician's practice. I mean, there's, and you can go to their website and check it out, but there's so many different things that's why it's kind of a whole body, whole experience there, because there's an esthetician
programs there. And we do programs that you don't have to be a patient. Like you can participate in some of our programs, and we're going to be doing more virtual programs for education that you don't have to be a patient to get some health information from, because a lot of it's free, and we put out news blasts and things for you. So
what is the website? Thrive.com, is it?
Thrive Carolinas with an S. Thrive Carolinas with an S.
Okay.
Yep. Great.
Yeah.
Thank you.
All right, guys. It was good to see everybody. I like to see everybody's faces. Hi, I miss you all.
I am fine. Thank you.
Thanks, guys. It was great to see you.
Bye, guys.
Thanks. Thank you, Dr. Fletcher.
Bye.
Thank you.
Bye-bye.
Bye.
Thanks.